Yes, I can.
All right.
So, good evening, everyone. Thank you very much for staying tuned. We really apologize for the delay. We'll be trying to handle some technical issues. We're back again for the health show. Today, we have with us Dr. Morris, and is your host again, Dr. Ezekiel. So, Dr. Morris, over to you. Can you introduce yourself to the audience?
Okay. Thank you, Dr. Ezekiel. Good to be here. My name is Dr. Morris. I'm a pharmacist. Glad to be here once again.
Okay. All right. Thank you very much. So, today we're going to talk about superbugs. Superbugs. A lot of persons have been asking, what are superbugs? And why did we choose this topic, superbugs? So, superbugs basically is just a big word that has to do with um, antibiotics or microorganisms that we cannot see with our naked eyes. So these guys are strong, are big, and they don't get harmed by the antibiotics that we have around. So we have our speaker here is going to throw more light on that and tell us how the superbugs are formed and why they are formed and if any of us play any role to create the superbug bugs. So, sir, why or how are superbugs formed, Morris?
Okay. Thank you. So superbugs. So I think we should understand what superbug means before we can talk about what or how it's formed. So
Okay.
superbugs are commonly pathogens of uh, diseases. So when we say pathogens, we mean disease-causing organisms. So these superbugs are strains of bacteria, strains of viruses, strains of fungi. So that are resistant to the antibiotics that we have available. So before an organism is classified as superbug, that means it is resistant to an antibiotic. It is also resistant to an antiviral medication, and then also
Oh,
resistant to an antifungal medication. So when it is resistant to this class of drugs, that's when it is classified as superbugs. So
okay.
in summary, basically means organisms that cannot be eliminated by the common antibiotics that we have available. They are
Oh,
resistant to these antibiotics. So we have
okay.
three major types or three common types of superbugs. We have the E. coli, that's Escherichia coli, and then we have the Staphylococcus aureus, and then
Okay.
Klebsiella. So these are the
Okay.
three major or common pathogens that are superbugs. So
Okay,
what
sorry,
happens?
sorry, Doctor Morris. Those names are quite big. Okay, what I
Okay,
what I want to what I want to ask. I've been discussing this with somebody, one of a non-medic, and he was denying the fact that any of these things exist. So,
okay,
are you confirming that there are actually microorganisms that are resistant to all these antibiotics? So, like
okay,
superbugs really exist?
okay. I just want to ask one question, Dr. Ezekiel.
Yes, sir.
Uh, okay, have you been to Scotland?
Scotland? No, I haven't. I haven't been to Scotland.
Okay, but do you know that Scotland exists?
Yeah, sure. Scotland is.
Okay, so whether you believe it or not, Scotland exists. So
Wow. Okay.
narrow it down to superbugs now. Yes, some of personalities, some individuals might not believe that superbugs exist. But whether they
Yeah,
believe it or not, it doesn't really matter. It's
yeah.
actually exists. Superbugs, they exist. Superbugs, one of the causes of death worldwide. About 35,000 deaths in Europe are attributed to superbugs
Wow.
because they are resistant to antibiotics. So 35,000 people dying in a year. It's not a small figure.
Yeah, that's
So
much.
whether they agree that it's present or not, doesn't matter. But it is actually present. So I don't know if that answers.
Yes. That answered the question.
Okay.
Now, what do you think causes this emergence of superbugs? What do you think causes
Okay.
them?
So
Oh, yeah.
okay. So the superbug basically causes resistance. So if I use the word superbug, it might be complex. So let's use the
Okay.
word resistance. Let's use the word resistance.
Resist
So
resistance.
yeah,
Okay.
superbug is the major organism that causes resistance. So what happens or what causes drug resistance? So when we prescribe antibiotics or recommended antibiotics, depending on and we decide not to complete the medication because we actually feel better. When you do that, the microorganism has a way of recognizing the antibiotic that was used. And then when it does it, it understands how the antibiotic works. And when it understands how the antibiotic works, it fashions a way of either avoiding the antibiotics or changing the process of how the antibiotic works, or it completely inactivates the antibiotic. So either of these processes, when it happens, it ensures that the next time you take the antibiotic, those bugs, those organisms now know how the antibiotic works. So it will either avoid it, or it will change the process, or it will inactivate the antibiotic. That way, it doesn't get to work. The disease gets complicated, and then we have loss of life. And then that will causes drug resistance. That's just one, when we don't complete our medications. And then two, when we don't consult healthcare professionals. So yes, we know access to healthcare is part of the challenges we have. But as challenging as it is, we must strive to assess, recognize healthcare professionals. Because when we don't, when we patronize quacks, we recommend drugs that are not ideal for the condition. Firstly, they find it difficult to diagnose the right condition. And when you have the wrong diagnosis, everything you are doing will be wrong. I remember when we were in school, when you are doing a class, mathematics, further maths, quantum chemistry, when you miss one of the functional groups, so you can remember that we're trying to draw a chemical structure, we're trying to draw a process. When you miss a functional group, you miss the end product, no matter how or no matter what happens. So it's the same thing. When these quacks get the diagnosis wrong, you are recommended a wrong drug. When a wrong drug, the organisms find a way of coding that drug, understanding how that drug works. And the next time when that drug is taken, it will not perform its duties because the microorganism already knows how the antibiotic works. That way, it becomes resistant to the antibiotic. So that's another way of drug resistance. So another way again is antibiotics misuse. Okay, my neighbor, my brother had chesty cough, went to the hospital. I didn't understand the diagnosis. I didn't understand the query, but I saw that he came back home with amoxicillin carbonic acid. And then in the next 2 months, I had cough, and then the same chesty cough. Then I refused to see a healthcare professional. Instead, since my brother used amoxicillin carbonic acid for his cough, I had to buy the same combination I used for myself, not knowing if the organism causing my chesty cough is sensitive to amoxicillin carbonic acid. So that is antibiotic misuse. So when I do that, if that antibiotic is not sensitive if the organism is not sensitive to antibiotic, it grows resistance. Then the disease becomes difficult to treat. One of the most common diseases that have developed drug resistance is pneumonia. Pneumonia is one of the silent killers, highest killers.
Okay, since we just lost our guest speaker there, just a few highlights of what he has been saying. He mentioned that misusing and using an antibiotic that was not initially diagnosed for you can actually cause resistance and create the superbugs that we're talking about today. So if you're listening out there and then you are part of the people who usually remain cut for me antibiotics, just like biscuit or bread or fish. You beg for fish, beg for biscuit, beg for bread, and you also want to beg for antibiotics. It doesn't work like that. All right, you're making the medical world more difficult to practice, and you're making patients going to be difficult to heal. Now you may say it affects. It's just me. It does not. It's not. It's just me that is taking it. It's not my neighbor. Yes, it may just be you, but when that infection that is in you gets into your neighbor, it becomes resistant to the drugs that you are going to use. So I think we have our host back. Sir, welcome back. Sorry, we lost you there.
Okay, sorry. I had a talk issue, so I was locked out.
Okay. So you were
So
saying?
I'm back now. Sorry.
Okay.
Okay. So pneumonia. Yes, for the fact that my child responded to particular antibiotic managing pneumonia doesn't mean that my neighbor's child responds to that same antibiotic. So that's
Okay.
antibiotic misuse. So and then antibiotic abuse. So how do you abuse antibiotics? Some patients, some individuals take antibiotics for the fun of it. So because they are used or they like the taste of antibiotics, they tend to abuse the antibiotic. So even when you take antibiotics and you don't complete the dose, you abuse the antibiotic. When you take antibiotics and then you feel better just after a single dose or after 2 doses, you have abused the antibiotic. When you keep doing that, your body becomes or gets used to that level of antibiotic that it will not work next time again. So let me break it down to make it easier for non-medics. So if I go to see a healthcare professional and I'm recommended metronidazole as the antibiotic of choice. So
Metronidazole is not quite new. I think
yes,
flagyl. So.
flagyl. Okay, flagyl. So as the antibiotic of choice, and then I don't take that flagyl for at least 5 days or 7 days or 10 days as recommended by the prescriber. What happens is that the antibiotic needs that number of days to be able to form a lethal dose to clear up the microorganism. So when you don't take that number of, or when you don't complete the dose, you give the organism opportunity to multiply. And as it multiplies, it mutates into new organisms that are resistant to that flagyl. So next time you are sick of that same condition, you will need a higher dose of flagyl, or you will need another antibiotic entirely. And then when you need a higher dose of flagyl, the higher the dose, the more you're exposing yourself to side effects of flagyl. So that's why I recommend a drug, no matter how inconvenient it is, you complete the therapy. If it is so inconveniencing, you contact your prescriber, you understand your condition, and they recommend an antibiotic as convenient for you to take. But sometimes it's not for your convenience, it's for you to get better and live longer.
Okay. All right. Thank you very much. Thank you very much. If you're watching, if you have any question for the guest, you can type it in the comment section, and then we'll be able to read it out to him. But in the meantime, I have some questions for you, sir. There's this popular idea. Oh, we lost our guest again. I really hope he get back to us soon. And the question, when it comes, I'm going to read out the questions for him. So if you're just here for the first time, kindly hit the subscribe button and turn on the notifications so that whenever we are live like this, you will know, and then you can easily join when we discuss about different drugs and different medical conditions. So I think we have our guest back. Sir, can you hear me?
Yes, I can hear you clearly. Sorry.
Okay, now, so the question I have is, there is this popular idea that antibiotics they dry blood. I don't know if you have heard something like that. So it says it dries your blood, it
Yes.
reduces your blood. So then people tend to take it for either what you're supposed to take for 5 days, you tend to take for 3 days, or you're able to take for 10 days, they take it for 5 days or so. They tend to reduce the dose. So what do you have to say? Do you think antibiotics, or there are any antibiotics that dry and reduces blood?
Okay, thank you for that. So, okay, I'm looking for it. Okay, so antibiotic, it doesn't dry up blood at all.
Okay.
That's a
Okay.
myth. So it's just a myth. So one of the side effects of some antibiotics is to cause weakness. So make you feel weak, and then that's why they think antibiotic dries your blood, because we all know that in Nigeria, once your PCV is low, it has a way of major symptom is weakness for PCV.
Yeah.
So they feel as I take an antibiotic, I feel weak, and it is drying up in quotes your blood, but it doesn't do that. Antibiotic, they never do that. So what antibiotic does is to make you, some of the side effects are to make you feel weak. So sometimes some of the antibiotics, when prescribed, they are advised that you should go with food. So yes, food increases absorption for some of these antibiotics, but then food also helps in times of weakness. And then for those that also cause hypoglycemia as side effects with food. It increases the release of glucose. Then that also helps the patient to feel better. So depending on antibiotics you're taking, if you don't feel strong while taking antibiotics, rather than stopping the medication, rather than withdrawing from the medication, it's that you seek the counsel of healthcare professional when it comes to drugs. And that's the pharmacy. Speak to your pharmacist when it comes to the drugs so that he will understand the side effects they are going through and then can give you proper advice. You don't withdraw from your medication without consulting your pharmacist. You speak to your pharmacist, you agree with the pharmacist, and then you work together to see how you can achieve or get the best for the medication for you to feel better.
All right. Thank you. I have another question here, and it goes like this. There are some persons who wants to flush their blood. I don't know if you've seen them. They want to flush their blood. Now, which antibiotics is best to flush blood? And do you think there's anything like flushing blood? Flush their system or clean their blood?
Yeah, it's common, especially with the youthful population. So there's no antibiotic to cleanse blood. Please, I'll say it again. I don't know if I'm permitted to say it in pidgin English.
Yes, you can speak in pidgin.
Antibiotics, not the flush blood, not the flush system. Please, antibiotic doesn't do that. We are contributing to the increase in resistance. Please, if you don't feel okay, please consult a healthcare provider to run a test for you and they recommend the right drugs for you to take. So if you need to detoxify, I think fruits, the mixture of fruits helps in detoxification. You don't need antibiotics to detoxify. Fruits can do that for you. So aside the fruits, there are also supplements recommended by FDA, approved by NAFDAC. They're not saying it works or is intended to treat or heal. No, it only helps you to feel better. That's why they're called supplements. It works in addition to your daily food. It's not intended to treat. So those can help you to detoxify. And then another way you can detoxify is simply by fasting. Fasting. You stay away from food, just water for as long as you can. That helps you detoxify. In fact, fasting helps the body go through a detoxification process. That's one of the best ways to detoxify. And then drinking lots of water. One of the contacts I follow on Twitter, apropos doctor, is always emphasizing on the need to drink water.
Yeah.
Water has a whole lot of benefits that we are underrating, that we don't understand. Water alone is a good detoxifier. We don't need antibiotics to detoxify. No, that's not necessary. When you do that, you are contributing to antibiotic resistance. Please, I beg, make we find that way to detoxify. Leave antibiotics alone, please.
Okay, all right. Thank you very much. I have just two questions before we call it a day here. The first one is antibiotics immediately after sex. What do you have to say, especially the idea of using these ampiclox, 1 capsule of ampiclox after sex? We're talking about superbugs. Now, how does this contribute to the formation of superbugs? And is it even proper? And if it's proper, what should be done? Like, is it even proper to use ampiclox after sex? Like, does it do anything?
Okay, so I don't know who started that story, that myth. But we need to find that person and get the person arrested first, so he can see the story. Okay, so after sex, ampiclox does nothing for you. It doesn't prevent pregnancies and it doesn't flush out sexually transmitted infection. No, it doesn't. You're only abusing the ampiclox. Why they think ampiclox works after sex is because normally penicillins, one of their characteristics is that you can perceive it, the odor in your urine. So they feel ampiclox is washing out the bacteria. No. When you take ampiclox, yes, when you take ampiclox, especially Picham made by GSK, you perceive it in your urine. That's one of the major signs of penicillins. So they feel with that odor in the urine. That means the antibiotic is flushing out the sexually transmitted infection. That's completely wrong. As I said, the person that invented that myth, we need to look at that person and have a one-on-one talk, just one-on-one, to see how we can get him convicted. So when it happens, when there is sexual intercourse and you're not sure of the partner, so what happens is you visit the healthcare professional. There are drugs you can take that will help you to prevent pregnancy. And then also, if depending on the risk of exposure, they can recommend other drugs to prevent sexually transmitted infection. Ampiclox has no place in those drugs. No, not at all. Not at all. So, and then, of we said now, one of the most common superbugs is occurring in gonorrhea. There are resistant strains of gonorrhea now that are incurable. In fact, it's now one of the causes of death in Europe. Gonorrhea that are not responsive to any class of antibiotics. Rocephin, okay, I don't want to mention branding now. Ceftriaxone, amanic acid, azithromycin, levofloxacin, they don't respond to it. So it's yes, it requires a lot of completion and the newly developed molecules for it to clear up. If you are fortunate enough, most of them die. So please, using antibiotics, using Ampiclox immediately after sex to prevent STIs, it doesn't work. You're really complicating issues for the healthcare professionals. You are increasing the chances of drug resistance. Please, if you have sex and you think you are exposed, please consult a healthcare professional. There are processes to this. There are processes to this. There are processes to handle this to ensure that you don't get infected with STIs. You don't take Ampiclox to prevent pregnancy. It doesn't work. If you have unprotected sex during your ovulation cycle, and then you end up taking Ampiclox, please, if you have my contact, please, you can call so I can prepare Pampers and Nan for you, because you will surely get pregnant. So Ampiclox doesn't prevent pregnancy. It doesn't at all. Instead,
doctor, there are some persons who have life experience. I don't know if you have met these persons. To tell you, there was one patient who told me to my face, say the sex she didn't take Ampiclox was the one that she actually conceived. She wanted to leave the baby. Say every other one she has been using Ampiclox, the baby has not been staying. Are you sure this is not something that the pharmacist or the doctors needs to research into the miraculous function of Ampiclox in that regard?
Okay, so also I have the opportunity of working with the inventors of Ampiclox. So, and we've not had any information showing or supporting the evidence that Ampiclox has been preventing pregnancy. No, it doesn't. The patient that you had is just fortunate enough that she was having sexual intercourse on her off period. So the only time she didn't take Ampiclox was during her on period, and that's why she was able to take it. If she has sexual intercourse when she's ovulating, even if she likes, she can take a box of Ampiclox, she will still get pregnant. So Ampiclox has no effect preventing pregnancy. Please, there are methods of preventing pregnancy that are available. Also, the healthcare professionals to give you advice. Even 48 hours after having sexual intercourse, there are drugs to prevent these pregnancies. You don't need to fall on Ampiclox. No, Ampiclox doesn't provide that, please.
Okay.
Yeah.
All right. So, lastly, the question I want to ask is, some places they will go to the lab, they do a lab test for infection, and they see the results, and they see the drugs that can work for it, and subsequently, maybe a few weeks later, they have the same symptoms. Is it proper for them to still use that same lab result, or do have to go to the lab to do another test again properly? What do you have to say about that?
Okay, thank you. So with due respect to my medical laboratory scientist colleagues, I think they need to put in more work in sanitizing the laboratories, in sanitizing the practitioners in the laboratories, because we see a lot of funny results coming out from the labs. So we really need them to come on board and sanitize the system. So because there's a high chance that the lab result was wrong in the first place. So sometimes you can take antibiotics and it suppresses the symptoms, not that it takes care of the parasites or the pathogens. No, all it does is suppress the symptoms, the fever, the pain, and then after a while, short time, those symptoms are back again. Then the patient, rather than going to see a healthcare professional, goes back to take the same drugs. And then when you do that, you are increasing the chances of resistance. So it's important that we sanitize our labs so that when we go for tests, we are sure of the results. Because sometimes you see test results and then you see Rocephin resistant, then you see Ceftriaxone sensitive. In fact, highly sensitive. So these are very funny scenarios. So with those kind of lab results, that also contributes to an increase in incidence of drug resistance. So please, if you go to the lab and because you feel sick and have symptoms, and then after taking the drugs recommended in lab results, and then you fall sick again, please, rather than use the same drugs, please see the healthcare professional. Very important. It's very, very important.
Okay. All right. Thank you very much. Thank you very much for your time, sir. Thank you very much for everything. The audience, thank you very much for staying with us. We are almost done. Before we go, we'll just really ask him to leave a word or two for our viewers, just in case you're watching. For Maurice, I don't know if you can give a parting words to those that are watching and see what they can take
Okay.
home.
Okay. Thank you, Dr. Ezekiel, for this opportunity. It has been worth a while. I was hoping that it would be like a 2-hour session because drug resistance is really an issue. It's really a thing.
Yes, sir.
But,
Yes, sir.
Practically begging that please, it's very important that we consult healthcare professionals before you take medications. Thankfully now we have avenues we use to assess quality healthcare and quality healthcare professionals. We have the HMO schemes, we have the NHIS, we have the state health insurance scheme, we have international. There are various opportunities to access healthcare. In fact, we have HMOs that you can access as low as 30 times a year, and then you can access a whole lot of treatments. And then we have the state government insurance schemes that pay 7,000, 8,000 a year and access healthcare professionals. Then we have the other, depending on your pocket. So
Yes,
please,
sir.
let's make advantage or take use of these opportunities to get ourselves. In developed countries, they are focusing more on preventive medicines because they now see and understand that curative medicine is very expensive and also leads to drug resistance. So instead, let's focus on preventive medicine. What does preventive medicine means? Basically means we should prevent the diseases rather than cure. How do you prevent? By living well, taking hygiene, exercise, responsible, go for medical check. Consult healthcare professionals, not quacks. When you feel unwell, speak to a doctor. When you feel unwell, speak to a qualified healthcare professional. That way, you help to reduce the incidence of side effects. And then to my fellow healthcare professionals, there should be enough evidence, enough rationale to recommend antibiotics. The guideline already developed by the WHO in recommending antibiotics. The patient should get antibiotics only when it is needed. And then for most cases, it should be after sensitivity result presented.
Has been
So,
conducted. Yeah.
but for some cases, there's room for empirical therapy. And then when it comes to empirical therapy, there are drugs that have broad spectrum of action. We should use those drugs pending when the sensitivity results are out, be able to streamline the treatment to the pathogen and antibiotic choice that was recommended. Please, so that we can reduce the chances of drug resistance. Drug resistance is becoming a thing. In the past, with amoxicillin, we are fine. But these days, we are gradually relegating amoxicillin. In fact, in some facilities, I see them recommending meropenem already. These antibiotics
Wow.
are supposed to be reserved for drug-resistant organisms. But now, it is being used. That's the worry. So there are different classes of antibiotics. There is the access, and then there are those that are reserved. Access is antibiotics that can easily be gotten. One, then also that provides response. These are the ones we should start with. And then when they're not responding, we can switch based on results. Unless you're according to your clinical discretion, you see that this case requires strong antibiotics. But please, let's pledge to ensure that patients get antibiotics only when they need these antibiotics. Thank you very much.
All right. Thank you very much. Thank you very much, sir. We have
Thank
heard and see that superbugs are real, and
you.
they are most times incurable. So, in order for you to stay free, you just have to ensure that you're part of the population who completes and use antibiotics only after it has been prescribed by a health professional. Thank you very much for staying tuned. We'll catch you in our next video, same time next week. Bye bye.
All right. Bye.
Bye bye.